When Tyreek Hill injured his left knee, we knew right away that it was serious. How did we know? Because his left leg was facing about 90 degrees to the left of where it should have been. And the only way that happens is because of a knee dislocation. When dislocations occur, it means the bones are moved out of position relative to one another, and structures have to fail to end up in that position, some of them critical to the health of the leg itself. To understand why it's so important to get an athlete to the hospital for evaluation after an injury like this, we take a look inside the blue tent. So we're looking at the front of the skeleton here. We're going to focus in on the knee joint. The knee joint is formed by the femur or thigh bone, the tibia or the shin bone, and you have the little patella or kneecap that is floating there in the front. We turn the skeleton to the outside. You see the fibula, long skinny bone that does more at the ankle, but it is important when you're talking about knee dislocation. We have cartilage that covers the end surface of the bones. That can get damaged in this type of injury. We also have the very important meniscus. You have two, the lateral on the outer side of the joint and the medial on the inner side of the joint. Because of their close relationship with the joint, they're at risk with a knee dislocation. And here on the back, we're looking at the posterior cruciate or PCL ligament, and then just in front of it, the ACL. Cruciate means cross. These two cross each other deep in the joint. Again, with a dislocation, significant risk to these ligaments. We also have two ligaments that are more superficial that come into play here. The lateral collateral on the outside of the joint and the medial collateral on the inside of the joint. These provide control for side-to-side stability issues around the knee, and they can get damaged with the dislocation. But perhaps the most important structure when you're talking about this type of injury is the artery. The popliteal artery runs down behind the back of the knee, and it can get damaged as well. It sits very close to the knee joint, so in a dislocation, especially one that goes posterior or posterior lateral, that can get torn. You only have a few hours to fix that before you suffer irreversible tissue damage. Now we've added the nerve structures in, that's the yellow here. One branch here comes off the backside, wraps around the fibula. This is the peroneal nerve. This is very important for muscle function and for sensation in the lower leg. It too can get damaged in a knee dislocation. If we add the muscle layers back on the top, the quad on the front of the thigh attaches to the shin bone through the patellar tendon. If the forces push the knee anterior, the patellar tendon can also get damaged. If we switch back to the backside, you're looking at the hamstrings, which have attachments on the lateral and the medial side, and the calf muscle, which also crosses the knee. Any or all of these structures are at risk with this type of an injury. So obviously with a dislocation, you have the potential for so much damage. Tyreek Hill was fortunate to not have artery or nerve damage, according to his agent, Drew Rosenhaus. He did have ligament reconstruction, and we'll just have to see how he does during rehab, but Rosenhaus says he could be ready to play next year.